Hello, ladies and gentlemen, boys and girls. Welcome to the Excellence in Impact Foundation podcast, where we engage with world-class performers in the areas of healthcare, education, entrepreneurship, and leadership. It's been a long break since we had our official launch to our gala on October 4th, and I've heard a lot of calls why we took such a break. That is worthwhile because I was doing my possible best to come back even better and stronger. And we have today none other than one of my mentors. I'll just let him introduce himself to us, Mr. Kilian Songwe. Can you start by telling us, giving our viewers around the world, who you are, what you do on a daily basis, because you are such a dynamo, and we're very pleased to have you here.
First, I must say thank you. Thank you so much indeed for doing the hard work of identifying me, researching me, and then being able to reach out to me. It's certainly my pleasure to be here on the podcast today and to share some of the things that I've been able to go through, the challenges of life, the challenges of being an entrepreneur, the excitement of being in public health. And for me, inspiration is key, and having mentors is excellent, and always riding on the shoulders of the people before us could never be better. So I'll just start off by saying my name is Killian. I am Cameroonian, like most of the other Cameroonians around the world. I think I carry a dual nationality, but we do that because we have to do the things that we're going to do in the world to make the world a better place. Today, I run my own company, the AG Group of Companies. The AG Group of Companies is a consolidation of three different companies: a Global Healthcare Public Foundation, AGHPF, a Global Quality Consultants, AGQC, and QCHRM, Quality Consultants Human Resource Management. So those three companies come together to form what we call the AG Group of Companies, which have been heading now for almost the last 22, 24 years. I've been doing this for as long, and it's all in the healthcare space.
Wow.
Is in transfusion medicine and public health. I do a lot of teaching. I like to call myself a teacher. So I used to teach for Australia University, GW. I now teach for the University of British Columbia out in Canada. Yeah.
That's quite a handful. So you have three companies. So you are what we like to refer to as a health entrepreneur or healthpreneur, because everything you do has to do with healthcare. And I believe that healthcare as a universal right is one of the things that calls for a lot of innovation, a lot of people like you who are willing to spread your wings and have a broad brush. Can you tell us why do you have three companies? Is one not good enough?
Yes, that's an interesting question. These are the things you learn, and I really hope that the people who listen to this podcast will immediately pick it up and run with it, because I have already done the hard work for them. So
True.
the first company I founded a Global Healthcare Public Foundation, I think in August 2000 or 2002, thereabout. And when I founded that company, I had just finished working with the Clinton administration. Bill Clinton, one of the things he said to all of us who worked in his administration in one way, shape, or form was he said, we should go out and do good. And how to do good was trying to see how I could improve healthcare on the African continent. In the early 2000s, the big thing at the time was still HIV and AIDS. That was at the time. And at that time, I used to be the vice president at Panacea Pharmaceuticals, one of the big pharmaceuticals out in the Washington, D.C. area. I was trying to leverage my work experience, my company, and see how I could support the continent. I started off with a massive donations of prescriptive drugs on the cancer line and some of the other drugs to a number of countries on the African continent. But now that was an NGO, as it was a Global Healthcare Public Foundation. And with time, I found out that, yes, the foundation was great. I was getting all these donations from people who were doing all this work on the continent. Today, as I speak on the African continent, we are present in at least 26 countries. We have offices in 6. That's almost more than 50% of the continent. It's a 55 continent. Moving on to the second company, we found out that some companies want to do business to business,
B2B.
If you're going to do a B2B, the foundation was just not the place where it was going to happen. Founded Allo Global Quality Consultants, which is the business arm of a Global Healthcare Public Foundation. So exactly the same thing. It just depends on who the client is. If the client is a business guy who wants to do B2B, then AGQC was the right fit. And if it's one of the charity outfits or one of the government outfits or the triple Ps, then that will fall under the foundation. Again, now, as I say, to people who are listening, this is a quick fix now. You just know immediately if you started a foundation, you started one of those charities, you quickly want to turn around and create the business arm, because our companies who want to work exclusively for tax purposes and other intentions with other business companies, not with not-for-profit 501c3s and those kinds of things. And so that's why we founded the second company, which is an exact replica of the first company. Because I am an entrepreneur and I know when good business sense rings, you take advantage
So
of
you're
the instincts. And what happened was we just found out that between the two companies, we're making a lot of referrals to people who went on and got employed or who were taken on to do work by other companies. It made simple business sense. For us,
percentages.
we created QCHRM. It has one employee, and that employee's job is just to read emails and reply to them. And then we make our recommendations to QCHRM. If that person gets employed, QCHRM gets some of the jingles, and no work done, no energy lost, but money made.
That's how you leverage your relationships, your expertise over a long period of time. So just keep turning things. Wow, that's amazing. 3 companies in the last 22 years, and it looks like you're just getting started. Because, like you said in the intro, you are one of the most difficult people to get. You are constantly on the move. It looks like you are Catch Me If You Can, Leonardo DiCaprio. But you're always traveling. At this time in your career, do you suffer from jet lag? Because anytime I text you or call you in Africa, you are in the DRC, you're in Burkina Faso, Uganda, Congo, everywhere. Does jet lag still bother you? Let's just tell our viewers you are in New York. You have a home in the US and you live 9 months out of the year in Africa. Is that about
God.
right?
I actually don't even know what I do these days. I just know that most of my gray matter is now on my face.
At least we can see
All
that
the
too.
oxygen, all the lack of oxygen I have by being in the air. But I am technically on a flight every 10 to 15 days. I'm on a plane going somewhere, coming from somewhere, meeting with some government official, discussing some policy issue, talking about the healthcare of that country. It has just become a part of me. I don't know that there is anything called jet lag now, because I have used the same travel agent since 2007. What that does for me is I call him and I say, Derito, I need to go from here to here. He knows everything about how I want to travel, what class I want to travel on for that particular trip. He has it all taken care of, everything. And all I need to do is get the ticket and go to the airport. And it's a very important thing. If you're going to live as busy a life as I live, you cannot afford to manage and control all of those things. You really have
To delegate.
Yes, you have to have some really good people around you. I have a phenomenal secretary who manages my schedules, and I get those calls early in the morning. Hey, Prof, you have to be here. You need to do this. There's a meeting coming up. I'm like, are these all happening today? Yes, they're all happening today.
I once read a book by this business guru guy. He said, if you don't have an executive assistant, then you are one.
Yes. And then if you are the one, then you end up double booking because everything is important.
So if you don't have an assistant, you're one, which speaks to what you said earlier, right? The importance of delegating, having trusted people in your circle who are there to soak up the day-to-day minutiae, because your job, you are the brains, you do the high-level stuff. You need people like your agent and your executive assistant, because those are the people in the background who make the wheels churn.
Absolutely. You need people like that. If you're going to be successful, you need a team. Right? I keep on
Oh, yeah.
telling people there is nothing. There are two magic words that I tell people all the time as a business entrepreneur. The first one is team, and the second one is network. You have those two things, you're ready, you're good to go.
Yeah.
And we end the podcast right now. But that's it. You have a team,
I
and
love it.
you're good to go.
I love it. Speaking of teams and networks, how do people cultivate networks? I'm happy to jump into that because it's something that I've learned over time. Your network is your net worth. I've heard that in some books, right? To what extent is success based on your connections, relationships, or hard work? What I'm hearing you say already is that network. So it's people in your home, right? So to what extent is success come down to the people, or is it just like you working hard, or is it a combination of both?
First of all, you must work hard because you
Yes.
want to build a network because you've done some successful things. And
True.
then people come to respect your work and then they come to trust you. And then once
Mm,
they respect your work and they trust you, your network builds because of that trust and respect.
got it.
Will have to do some good work, earn some reputation, earn some trust, earn some respect in the industry, whichever industry it is. Once that happens, then you build a network that respects you because of what you've done. A lot of the times, I'll give you a very simple example. So there's some conferences I go to, and when I look at the agenda, I know every speaker. I
Oh,
always know verbatim what they are going to say. The reason I go is because I am going to be physically present where the network is going to be. I can renew my network and I can build on the network, get new people into the network, shake hands with people. When you leave, you've strengthened the network. A lot
wow.
of the times people are going to call you because of the network, not because you replied
Correct.
to some ad. No. Once you build a trusted community around you, even when you're not there, people are going to say, hey, there is Killian out there. Let's find out if he's interested. Then
Yep.
you have the luxury of denying to be interested before they move on.
Mm,
Game over.
yeah. Wow.
So, yes, first of all, you have to do some respectful work. You have to be trusted. Then you build a network around what you've done so that you become what I tell a lot of people, make yourself the go-to person. People are not going to
Wow.
trust you if you're not the go-to person. Because if
True.
you're the go-to person, then they don't need you.
Yep.
You have to become the go-to person to be able to get a network because that network needs you because you have solutions.
Provide value, and you provide value.
Yes. Yeah.
Wow.
Yeah.
That's amazing. You have a very unique perspective because you have worked in the US, the number one capitalist society in the world, and you have been working in Africa for the last 20 something years. How do those two paradigms, is it the same operational mechanism, or if there are any differences, please help us out because you are one of the few perfectly suited to have that view. You have done it at the highest levels in both spaces. Is it the same way of building or what?
I must tell you, it's like day and night. I start off by smiling because I'm actually laughing at myself. When I used to work on the US side and I would travel under the USAID banner or one of the other banners or CDC banner, and I'll go out to some of these countries and I'll be meeting with the directors or ministers of the Ministry of Health and those kinds of things. And we'll have discussions. I used to work for a very big think tank at the time called the Futures Group International, one of the premier healthcare think tanks on this continent. I remember going out for them and we would write all these nice proposals and all these beautiful policies. And then you come back 6 months to do a follow up and see nothing has happened.
It's
And
sitting on the same shelf.
you're wondering what happened. But now that I actually spend more time in Africa than on the US side, I laugh at myself because we conceived what we wanted them to do. And then we told them this is what you should do. And that was not a priority. Yeah, it might have been something that was needed, but there is a big difference between the needs and the priorities of these countries and what is going on there. And it's so interesting today to see when I look at some of the work I did on the US side for Africa and the work I'm doing in Africa for Africa. Sometimes it's day and night because you really have to have a comprehensive understanding of the challenge, the magnitude of the challenge, and there has to be a very clear deliverable that is going to come out. I'll give you a very simple example. Today, at least 34% of the patients on the African continent are suffering from malaria. If you look at Central Africa, East Africa, and some of West Africa, 34% of the patients that are going to go to hospital today are going to be diagnosed with malaria. Do you know how many malaria researchers are out there? How come we have not brought malaria to an end?
Okay, that's interesting.
There's a very huge paradigm difference between who is sponsoring the research and who is using the benefits of the research. If the research was sponsored and done by the benefactors, we wouldn't have 668,000 people dying annually from malaria.
What I'm hearing you say is that Africans need to be in charge of the research that goes into the problems that they need to solve. Right? All right.
It's just, these are some of the things for me, they're just the reality of the space. And when WHO says that as a country, we need to have X% of our GDP put into healthcare, there is truly a need. If we don't do that, we cannot do the. Today, there is Mpox. I am supporting Mpox in some countries on the continent, but our response is still so small. Mpox is one of the new epidemics that has just come around, very synonymous to smallpox back in the days as a skin that comes up on people. But again, we just left COVID 3 years ago, and now we're coming up with a new epidemic, yet our response, I'll call it lukewarm. But again, that's because we are not in control.
I happen to believe that outside philanthropy should be complementary. It is not mandatory. So, to what extent do you feel like Africans need to take more responsibility for our well being? Because you are talking about the funders of research, they do the funding, they write the proposals, or they have parameters that have to be followed a certain way, right? If we were the ones who were funding this research, do you think things should be better? Why aren't we doing it?
I think things will be much better. Again, I don't know that we can do it where we are today, but I think the consultation between the two needs to be more improved. The level of the dialogue needs to be increased.
So less of a prescription saying you have to do this and more of how can we help you accomplish this?
Once there is a better understanding, if you picked any country on the continent, let's take the middle belt of the African continent, you generally have at least two religions. You have a Muslim religion and you have a Christian religion.
Yes.
And I'm going to say Christianity for Christianity and Muslims for everything. There are huge differences when you practice in both sides. And so you can just have a policy that says in country A, this is what is going to happen. Because it's not going to happen. We have to take into account the trueness of the communities that are there. The truth is that public health is exactly the public good of the people. It must be something that is acceptable to the people for it to become a public good.
Wow.
Yeah.
So there has to be some buy-in from the recipients or the benefactors of these resources. When I started my Excellence in Impact Foundation, if people ask me, what are you doing differently? I was talking to a professor at Arizona State University, and he was like, so what are you doing differently? Why should, for example, the Gates Foundation give you money? And I said to him, I am feeling a void. I'm feeling a void because just like you said, we know our problems better than anybody else. If the Gates Foundation is dumping loads of cash in Africa, nobody's ever going to say no. But I'm looking at it from my vantage point. I know the people that I can talk to. I know their pain points because I come from there. So I have a different approach. And that is why I am talking to people like you on the continent. We are using trusted leverage networks to do our work. We use the Mandela Fellowship, which is vetted and young up-and-coming entrepreneurs across the continent. We use them to develop this progressive mindset of building young leaders, right? We're not doing anything new, but we are going to the source because just dumping a bunch of cash has never been solution. It is, and it's never going to work.
I don't think it's going to work, but I don't want to get into the politics. I remember flying a couple of weeks ago, and the gentleman sitting next to me was from the International Monetary Corporation, the part of the World Bank. During our discussions, I looked at him and I said, if I was ever made president of any country, the first thing I will close is the World Bank.
Really?
Yes.
That's a radical take. Can you educate us some more?
We need that kind of radicalness because we cannot continue going to the bank every week and asking for continuous support. Right now, the next generation on the African continent is laden in debt. For people who have taken money, we cannot see exactly what they've done with the money. So yet they've been approved.
Yeah.
Yet they've been approved. Some economists who is telling me at the World Bank that, oh no, this is a great project, but the monitoring and evaluation of the project really doesn't matter. Let's just keep on it's going to be done in the next. But the next generation is laden in debt because they'll be repaying themselves and therefore building their own economy.
So this man, I guess we should stay out of the politics here because
that gets me a little fired up.
I can see the passion, which it's palpable and I love it. Governance is a problem everywhere. To stay out of the politics because all these banking institutions to investors and all that. When you're talking healthcare, shouldn't we have rebate programs across the African continent because we are technically the poorest continent? Shouldn't there be forgiveness programs that can help people start up? Don't we have those?
I'm not sure about the forgiveness programs. I'm more inclined to look at incentive programs.
Okay.
For example, I'll talk about something that I'm doing. One of the main reasons why I came onto the continent was to improve the quality of diagnostic medicine.
66%
to 67% of the death on the African continent is due to wrong diagnosis. It means out of every 10 people that walk into a health facility, 6 of them would end up dead. And it has nothing to do with doctor error. It has to do with diagnosis, wrong results.
Can I say this hits a little close to home because I remember in 2004, my father had a wrong diagnosis.
Mm-hmm.
He passed away in 2005 here in Johns Hopkins in Baltimore, but he had a wrong diagnosis, which years after we came to understand that it had to do with wrong diagnosis. That hits close to home. I really feel terrible for a lot of people who don't have any kind of resources or support to even get diagnosed. There are a bunch of people who just get lost under the dust. Can you contrast that with the US? Wrong diagnosis, that's actually a problem here as well. Do you have any measurables, like how we can contrast those two? 66% in Africa and then here in the US?
I wouldn't say that there are, because again, which is the reason why I went to Africa, you have standards. We have bodies that are responsible.
That's fair.
For regulations actually happen. And as I was talking about incentives, when I talk about diagnostic medicine, for example, you can't do anything to a patient without diagnosis. And if we wanted to build a strong healthcare base, why don't we give incentives to healthcare facilities that are putting in place a regulatory environment, a management system that ensures we can drop 66% wrong diagnosis to 10% or 2%.
Wow.
We have diagnosis errors everywhere, but 66%. Tomorrow, let's drop them to 50%, then later on to 30%, and then it may be to 10% down the line. Now, once we put incentives in place for this to happen, instantly what you're going to find out is because diagnosis is getting better, there are outcomes behind that.
Wow.
And I have got right there. I prefer to look at incentives. What kind of incentives do we put in place? It's not about giving people equipment.
So it's about behavior. It's about behavioral modification and reframing.
It's about a mindset.
Absolutely. That's actually scary. 66%. So you spend a lot of time talking with ministers and CEOs of companies. You spend a lot of time with WHO and CDC. Like, how come there is not something across the African continent to really work on those diagnostics? Those numbers are terrible. Can we start in one country somewhere? I know there's some countries that are open-minded and progressive. You should know that. Like, where are we on that scale?
I think the advent of COVID was a really big wake-up call for the African continent. Just before the advent of COVID, there was already the creation of the Africa Centers for Disease Control and Prevention.
Okay.
Africa CDC mimics the CDC in Atlanta, USA. There is also the African Society for Laboratory Medicine around since 2009 or 2010. There are a number of outfits on the continent beginning to look at the approach and how they can make changes to this. But again, for me, as an entrepreneur, as an African, as a public health specialist, we Africans need to pay up. If we don't pay up, then we must play the tune that was paid for to be played.
That's deep. Can you break that down so people really understand it, please? Because what you just laid right there is, I believe, a blueprint for us taking extreme ownership and responsibility wherever we may be. I am here sitting in Phoenix, Arizona. You have spent the last 20 something years of your life trying to make my life easier. And there is millions of us in America and in Europe, all over the world. And I think you have a clear message. So you are challenging people, you are challenging Africans all over the world that we all need to step up. Is that the message I'm hearing from you?
Yes, and we're in different fields, and there are different ways by which we need to step up. One of the countries I work with and they do a phenomenal job at this is Nigeria. When you look at the amount of outreaches that their doctors from the United States do to their different it's just phenomenal. We need to multiply those kinds of things across all the countries and do some of these visits. And then make the countries understand there is a country whose name I wouldn't call now, where
I understand.
or to come in with a team just to provide it's done free. But that's
You know,
one aspect. There are other people who are working in other fields, in management fields, in policy fields. And we need to, I'll give you a very good example. Kofi Annan, may his soul rest in peace. When Kofi Annan was at the United Nations, he had an annual retreat with Ghanaians. And during his annual retreat with Ghanaians, they discussed the next dynamite. Surprised that Ghana is doing what it's doing today and is going.
Oh,
But Kofi
yeah.
Annan, the public health person, he was not in the medicine. We need to harness that kind of understanding amongst our people in the diaspora and our people back home. We need that kind of leadership. And for me, it's always about who is going to be the champion. That's really a challenge because most of the champions are not accepted in their own homes. But
Very true.
we need some champions who can help us to start having some of these discussions between our colleagues in the diaspora and back in whichever country it is. There is no looking down on anybody. If you look at the United States, for example, what is the ratio of American citizen doctors to foreign doctors? That tells you that we must know something and we have certain skills that we need to be using on the African continent and not somewhere else. But again, there on both sides of the coin, there is a sacrifice from us, but there is also a sacrifice from the state so that we can meet somewhere. I know any country on the continent is not going to give me the same kinds of salaries that we give our doctors here. They're not going to give me the same kind of liability insurance. But then it's a minimum that we can both agree to be able to give back.
I love it. And I'm getting a theme from you about the continent. I also subscribe to that continental mindset. I like to think of myself as a Pan-African. Africa is just one giant country, even though it's cut up into different borders. Love your whole aura, how you go about this. We are both from Cameroon, but you have spent the majority of your years on the African continent, most of it outside of Cameroon. How does that make you feel? That you are out there and you are doing phenomenal work. You just said earlier that the champions are never respected their own homes. I don't want to hit a sour nerve here, but how do you feel about doing some phenomenal work across Africa? Do you feel bittersweet somehow, or you are just happy that you are achieving the mission you set out to, which was to improve quality healthcare outcomes on the continent?
So there are some days when I feel a little disillusioned. All the beautiful things that I'm doing for all these other countries, I'm not doing it for Cameroon. Actually, Cameroon is one of the countries I cover for Africa CDC. To do some work there. I wish I were doing much more. At the end of the day, as they say, if anybody is sick anywhere in the world, we are all sick because it doesn't take longer before with COVID, we're now seeing the mpox. And so Marburg is now the thing that is in the East African zone. And we're all worried about it, even as far as Senegal on the far west part of Africa. So I think at the end of the day, for me, first and foremost, is if I could help improve the quality of diagnostic medicine on the continent, then at least we can have some places where people can go to and say, yes, I'm going to get this test done. And then we can reduce the number of flights to Europe and to the United States for the same diagnosis. when we could get it done on the African continent.
Question. Off the top of your head, which African country, in your opinion, today has the most comprehensive, accessible, and affordable healthcare system?
That's a really difficult question, and I'm usually very careful to call countries by names. I would say that there has been significant progress on the continent. We in Africa CDC lately, we've identified a number of countries as points of excellence for healthcare. So the Democratic Republic of the Congo that was identified. South Africa, there is, of course, Kenya, there is Morocco. There has been some conversations about what is going on in Morocco and Libya. On the west part of the continent, there is Nigeria, there is Senegal. So there are some countries that Africa CDC has used this checklist, and they've said, okay, let's look at how we can make some centers of excellence for healthcare, and let's see what countries we can use. There is no country that could be excellent in all the fields, but what Africa CDC has been trying to do is, as we go around the 5 regions of the continent, is trying to find out what is the center of excellence in each region. And then we can have some peer-to-peer exchanges between the different regions, so that if, say, for example, there is a specialty in the eastern region, then we can have people from the west or the south go there to learn that specialty. Then over time, as a continent, we can all flourish just by building different centers of excellence.
Wow, that's amazing. We here at the Excellence and Impact Foundation, one of our focus areas is healthcare. Without a healthy society or community, nothing starts, right? We partner with Project Cure. I'm sure you know about Project Cure, which is one of the, I think as of last year, they have become the largest distributor of donated medical supplies to developing countries. We have an exclusive partnership with them to raise money and send containers anywhere in Africa. The goal here is to work with partners who have that vision to actually affect change on the continent, right? So our 2030 goal is to touch 5 million lives. That's an ambitious, crazy goal. But one of those containers touches the lives of about 40,000 people. So it's amazing. And I just wanted to ask you, from your perspective, you said earlier that it's not about medical supplies, it's about mindset, right? But to what extent do medical supplies actually change people's lives? Given that the mindset.
I must
Yes,
say,
go ahead.
when I first started work on the continent in the early 2000s, I distributed medication and supplies to a lot of the health centers. I was much more interested in health centers because they were more in the community space. In most families in Africa, there is usually a breadwinner.
Yes.
When that breadwinner is not healthy, you have more than 10, 20 people who are affected. Directly affected. This is not impassive. They are directly affected. And when you bring in supplies and people can get treated and they don't have to go out, and some of the things I hear, somebody goes in for a radiology test and they're told they have to go and buy a film. If you can donate that film, that person just saved about $25 in any country on the African continent where the income is less than $2 a day. To have saved $25, that's food for the whole month.
Absolutely.
I really want to put it in perspective so that you can actually see it and measure it and feel it. There is nothing small in terms of a donation, but what is really critical is how it is going to be used and the accountability for its use. When I started, I was more interested in the community levels because there is a huge exodus of people from primary healthcare centers into tertiary care facilities. There is only one reason for that. The health centers do not have provision to be able to take care of the sick. So the person stays sick for a long time, and then by the time they get to the health center, must refer them to the reference hospital.
Wow. Okay.
So it's a paradigm of pain. But so my interest
of pain
with that kind of understanding was, how can I support the tertiary healthcare centers? How can I support things to the tertiary healthcare centers so that diagnosis could be made faster, decisions could be made faster, people could be quickly advised, so that people don't hang around. And then by the time they make it to the next level, the amount of capital that is needed just in transportation. Let's not talk about healthcare, transportation, because that person has to travel with a caregiver. So that means at least 2 people have to go. In most cases, it's 3 people because they have to work in shifts to take care of that. Then they have to pay medical fees when they get to where they're going to. And they still haven't started healthcare.
Just logistics. Wow. Man, you have such a wealth of knowledge. We could talk about this for days. And I want to ask, I know a lot of people reach out to you who are aspiring health entrepreneurs in the African space. Like, oh, you've done a lot of the groundwork. Why would you just tell somebody, like in 3 sentences, you want to start a hospital, a lab, a clinic, in a preventative medicine risk, I don't know, consulting? What would you tell them? How would you help them leverage their resources for maximum impact and good for the community?
One word: passion.
Wow. Passion. Why passion?
You have to feel it in you. Don't feel it in you, the obstacles are enormous. Somebody said to me in one of the countries, but we've been doing it like this. People don't die. I said, no, dead people don't talk.
Oh my goodness. That's funny. Of course, that.
One word for me, it's passion. You
So by passion, that fire that cannot be extinguished, no matter what.
Absolutely.
Wow. You've been 20 something years strong. It looks like your passion keeps increasing every day. Wow. That's amazing, because if you want to do anything above ordinary, it has to come from inside. Anything that is worth doing beyond just superficial, you have to be passionate. You need that grit, especially in Africa. And Africans have a lot of grit. You need to bring it over there.
Bill Clinton said one thing very simple: you have to do it like your life depends on it.
Oh, I think I've heard that. At one of the speeches, he has given.
So if you don't do it like your life depends on it, then don't start.
Speaking of Clinton, I know you and I had a previous conversation where you mentioned something which gave me goosebumps. You are one of the few people who was actually in a room with Bill Clinton and Nelson Mandela. Is that right?
Yes.
Tell us how that came about and what that did to you, because I'm imagining just by being in that room, you had the pressure to do something with your life. And I think so far you are living up to it. How did that come about?
Oh, this was Barcelona. This was the HIV/AIDS conference of Barcelona. That would be 2002, actually, in Barcelona, Spain. Nelson Mandela was very frail and didn't do a lot of public functions. And he was invited to this. And then there was Bill Clinton, a big champion of everything HIV at the time, who was in Barcelona. My relationships working with HHS when he was the then President Bill Clinton for that, because this was just a year or 2 after he had just left office. So I'm down in the green room. Of course, I went to see my former boss. And the green room, and who else is there? There is Nelson Mandela. And I'm like, wow. The moment is overwhelming. You're standing there and you're looking at them and you're saying to yourself, my God, how did I get here? How did this happen? But again, it's so serene because they're very different people from 2 very different worlds. They're going with their vision and that kind of thing. Just to see them and watch them talk to each other, and to think they actually have time to make a joke and laugh at the joke. And it makes life real. It makes life simple. It's not all about some of the heavy duty things that we want to do. But for me, it was a life-changing moment. You look at people who have given so much for very little, and you wonder how much more you could give or not give. We are complaining about very mundane things on a daily basis. Absolutely. And there are people whose lives have been, pretty much spent trying to make our lives better. Man, that's amazing. Did you take autographs? Did you take photos? Nelson had a problem with his eyesight. Anything with flashes, he couldn't do. Unfortunately, you only had to use the official photographer, who was very busy. I have one picture from that episode, which was actually a side picture, not a full picture. We couldn't do pictures because it was an official request by Nelson Mandela's office. At the time, his eyes were posing a big problem, so flashes were not allowed. So here you are as a trendsetter for African health entrepreneurs. What are the things you're most proud of? So 20-something years on the African continent. Prior to that, you had 10, 12 years here at the high level. What do you consider to be one of the things that you have done? You have these 3 companies which are doing immeasurable work. What is one of the things that you're most proud of? The decision to go work in Africa. Wow.
It comes back to that passion.
I remember when I told people, I said, I'm going to pack my box and move to Kenya. Kenya was my second stop in Africa. And at the time when I made that decision, I was the vice president at Panacea Pharmaceuticals, a big pharma in the Maryland area. When you make it all the way to VP, you don't just get one morning and leave. And I said, I'm going to go out there and this is what I want to do. I spoke to some very influential people in the healthcare space, and everybody looked at me and
it's like you're crazy.
People called my wife and they said, is he okay?
That speaks to that fire that comes from within. So there was this voice that was always telling you, you had to play a part.
I was responding to two very simple things. Number one, Bill Clinton said, go out and do some good. Number two, I had a lot of students at the time. I used to teach between Australia University and George Washington University. I had a lot of students from African countries, and they'll come up to me and they'll ask me, their father has come, their mother has come, and they can help them get into the healthcare system. And I kept on asking, what is going on that continent? People are always coming, and it turns out a number of these people, when their tests were repeated here, the results were just the exact same. Unfortunately, we cannot use those results because those facilities are not accredited. So those tests have to be repeated here because they are going to be repeated in an accredited facility. And that shifts the liability insurance. So somebody's a mother or whatever it is, systems over, and then you spend $10,000 doing the test. When it is time to actually get care, you've run out of money. So they go back to the continent with the exact same information they had before. I said, no, there must be something I can do on the continent that can reduce that burden. And that's really for me.
That's amazing. You took a deep dive. You had all this, and I think that when you get that nudge or that inspiration for people like Nelson Mandela or Bill Clinton, I think that no amount of talking you out, like that's never like you were going to go. No, nothing was going to hold you back. You were on this vision-driven quest to go and change something. It's worked out phenomenally well. A lot of us and countless other people are the benefactors of that passionate choice to go and serve in Africa. And it looks like you are loving it.
Oh, I'm loving every single day of it. I say the number of grandmas and grandpas who have blessed me, I don't need any more rest of my life.
Wow, that's amazing. And speaking of Bill Gates, I'm talking about the other famous Bill. So Bill Gates has this quote that I always like to ask all my podcast guests. A lot of people overestimate what they can accomplish in 1 year and underestimate what they could accomplish over a decade. You have vast experiences. Which one are you? The guy who has 6-month type goals, or do you plan in 10-year terms? And why? Which of them do you prefer? Why? If you have to.
My results must happen today, not tomorrow. The patient needs to go home today. It's cheaper for the family. So for me, yes, I zero in on things that I can do today that are going to have significant benefit. So I want to get it done today. I want to get it done now. I tell people that I'm lazy. I'm a very lazy guy. So I'm looking for what is the simplest, easiest way to get this done and get it done correctly and properly. I don't want to get into any long stories. Just how can we do this now? How can we do it simply? How can we make sure that it is cost effective?
Wow. You know what I call that? Strategic laziness. It means somebody who knows where they are going, what they need to accomplish. Like, I'm going from here. How do I get it? That's strategic laziness. That's amazing.
And again, let's go back to one of my two words, the network. Network.
Boom. Network is leverage, right? Because if you have the right people in your network, it cuts 3/4 of the time.
Absolutely. I'll give you a very nice example. I was in country X and I was supposed to meet with the Minister of Health. I showed up the same day. The letter introducing me arrived at the minister's cabinet. And so I get to the minister's cabinet and they say to me, no, you can't meet him. We've not had a chance to digest this letter. We don't know what the minister is going to be saying. I said, I'm in the country for 2 days. I have to see the minister. I sit right there, pull out my phone. I call the dean of ambassadors to that country because I know him, he's in my network. And I say to him, Dean X, I am in this country right now and I need your help. He says, what can I do for you this time? I said, I'm sitting in the minister's cabinet and I need to see the minister. Can you make a call?
Wow.
That's the power of the network. Yes,
My
that's
goodness.
the power of the network.
Wow. That is a masterclass in the power of creating influence networks. Because
Absolutely.
at the end of the day, everything happens based on relationships,
That's it. Relationships. Yes,
high value relationships.
absolutely.
A lot of us always talk about, oh, it's who I have come to find out that there's a level up to that. It's not about who knows you, because we all know everybody, but you and you of right. So everybody knows the president. How many people does he know? And the way you get yourself known by high value people is to provide value. You start by doing what building a reputation, and then the value network comes. You keep piling and piling, and you get to the point where you can get your phone and call people and doors open.
But also, it's a deliberate effort. It's a very deliberate
Absolutely.
effort. So you might have heard about the 6 degrees of separation. For me, it's a very personal thing. And I have my 6 degrees of separation. I'm now down to 3 degrees of separation.
I was just gonna say to
If I
you,
want to speak to, I should be able to make a maximum of 3 calls to speak to whoever I want to speak.
wow.
So that's
I
building
was
your network in a strategic direction. If I need to speak to so and so, I know these 3 people, one of them must give me the number to the person who's going to say, hey, there is Killian on the line. You need to talk to this guy.
wow. So you have put in the work and you have taken yourself from 6 degrees of separation to 3. So
Yes,
anybody on the African continent you want to talk to,
absolutely.
within 3 phone calls, you get them on the phone.
Absolutely.
Ladies and gentlemen, if ever there was a masterclass on the need and the importance of networking and providing value, you just heard it. It is passion, it is teamwork, and it's creating high influence networks.
Absolutely.
And like you said, it has to be deliberate. It doesn't happen by mistake.
No,
Nothing happens by mistake, right?
absolutely. It has to be very deliberate because there has to be a reason why I was at a meeting the other day in Congo with some people from the Global Fund. I walked up to this lady. She's a very serious portfolio manager. I said, I'd like to have you in my network. She looked at me and said, what does that mean? I said, I'd like for you to be one of the people I can reach out to when I need to make important discussions. Nobody's ever said that to her. And she said, how does this work? I said, no, every quarter we're going to have a meeting for about 10, 15 meetings. We'll just talk about some of the hot button things that are going on. The first time I meet with her, Mpox is coming up. And she says to me, Killian, have you heard about? I say, yes. She says, so what do we do? I say, let's go back to the drawing board on COVID. We do A, B, C, D. She's like, yeah, okay. Instant.
And I also remember that you had a detour when COVID had come about and you ended up being the COVID coordinator for the country of Uganda.
Absolutely.
Can you give us the backstory about how you ended up managing COVID relief for Uganda?
The COVID story is very interesting.
All right, let's go.
I am so sorry. It actually did say it was going to run out and I was trying to reach the cord.
So this is like live TV. It's happened on live TV sometimes. So this is it's called live.
You just have to do a joint.
Oh yeah, absolutely. Yes. Tell us about the COVID story. Like, how did you end up being the COVID guru, the COVID czar for Uganda?
So the COVID story is one of those things that happen in life. And again, this comes down to the element of passion. The passion has to be there. I had
Yes.
just left our office in Zambia and I was on my way to the United States, but I had 2 last stops. I was going to fly into Uganda because that's where my big office is. And then I
Okay.
would stop in Rwanda. And then from there, I would come back to the States. So I fly out of Zambia just when the wind of COVID had just started. And I land in Uganda. And while I am in Uganda in the first week, Uganda goes into a lockdown.
Oh,
Now I had a choice. Could have left if I wanted to leave. There were special flights for people to leave. My family is in the United States and I'm out in Africa and I'm not sure this thing is happening. Where am I supposed to be? And I see this is actually the turning point for my entire career because this is all about diagnostics.
right,
I
right.
decided, I made up my mind I was going to stay. If I fly out to New York, I'm just going to be one of the many smart people in Nassau County and nobody's will even be listening to me. So I said, no, I was going to stay on the continent. We had already been doing so much work in that space, in the diagnostic space. I said, we've been doing so much trainings, and that was going to be the first thing that would be needed. So I called my friends at the regional office in Brazzaville, and I said to them, guys, I am in Uganda and I am not going to leave. So if there is a need, you could reach out to me. And you wouldn't believe how things work out. Within another week or two, the Minister of Health, Dr. Ruth Jane Achen, makes a request to the WHO office in Uganda for technical support. And the office in Uganda did not know that I was there. They did the terms of reference, and then they sent it to Brazzaville. And actually, they had a candidate. Brazzaville said, no, the person you need to use is in the country, so call him out.
Wow.
From WHO, and like, we need this done. The ministry has asked for support in decentralization. We had to evaluate the country for testing centers, come up with a decentralization scheme, and then transportation of samples. Because all the other countries on the continent, when COVID broke, all samples were tested in the capital city. So it meant there was massive transportation of samples to the capital city. And so WHO called me, of course, and they said, oh, we've been told you're in the country and you can do this work for us. I said, what work is it and why me? And so they called me up and they said to me, oh, this is what we want you to do. This is what we're looking at. I said, okay, no problem. That's what my office has already been doing. And believe it or not, Uganda as a country had the highest per capita testing across the whole world.
How come?
That was because of the work that we did.
Oh.
We were able, in a very short time, to be able to say, hey, this laboratory is good for testing. Instead of sending samples to Kampala, send it to this facility. And so within a few weeks, we had facilities up, ready to test, quality approved, because that's what I came to the continent to do, to ensure the quality testing. So in a very short time, these are the facilities that are good to use. We had a number of laboratories that had been accredited to the International Organization of Standardization, ISO 15189, which is the standard for laboratories. That's really what I've been doing on the continent. So within a few weeks, we were able to decide on testing sites. We were able to decentralize testing. We were able to change transportation routes. And Uganda made it to the top of the chart for testing. Uganda had the highest per capita testing in the whole world when COVID broke, because we were able to decentralize testing and do
My
that.
goodness.
So when you talk about career highs, that might be one of those career highs.
At different places where they say luck is opportunity meets preparation, right? So I think that I believe in luck. I believe in hard work. The harder you work, the luckier you become. If that makes so it feels like you were at the right place at the right time. The country of Uganda won because now you guys set a standard for the most testing per capita. That's impressive.
Absolutely.
And I would like to believe that as a scientist, professor, teacher, I'm sure you guys are using that model. Have you taken that to replicate in other countries where you decentralize that in case of the next outbreak? Are you guys making sure that the accident doesn't happen again? Hopefully.
Actually, as we speak right now, that's one of my big assignments in the Democratic Republic of Congo, really talking about an integrated sample transport mechanism based on diagnostic network optimization, which tells us what platforms are where and how can we reach those different platforms in a quick time, so that it's not just doing the test. Doing the test is one thing, but more important than doing the test is how soon can I get the results?
Okay.
Yeah. So once we know where the different platforms are with the diagnostic network optimization, and then we can reroute the transportation, results can come back faster. And the faster results come back, the better the healthcare is for the patient or the community, even. Because if you're talking about cholera, for example, the sooner we can say it is cholera, the sooner we can make sure that the community is safe from everybody coming down with cholera. Yeah.
It looks like you're going to make some of us come over there because I'm sure you have enough work for us if we come over there.
There is enough of it all over the place.
So what's next for you, sir? I know you are here in New York now. What's next? You're going back to Africa, and what's coming up? Any exciting projects that our viewers can look?
Africa has challenges and
Opportunity.
yeah, which means opportunity. I'm now looking at South Sudan. There is work I want to go do in South Sudan. There is Burkina Faso, big TB situation in Burkina Faso. We're looking at how we can help the National Reference TB Lab, how we can do quick turnaround, liquid testing, which has a shorter result time of 21 days down to 7 days and those kinds of things. So there's some exciting things on my horizon. 2025 is not going to be any slower than 2024.
Wow. That's amazing. Good.
Yeah.
I want to thank you for squeezing this time. I know we have planned to do this podcast for the last 5-6 months. Finally, we were in the same time zone, 3 hours of each other, and I appreciate you for squeezing time to drop some knowledge and share your insights and to challenge our people and to provide them with practical resources and to share your story of passion and resilience and tenacity and a vision and a team. Like, you have just given us a masterclass today. I believe the biggest takeaway for here is that there's a lot of work to do in Africa and that everybody needs to step up. No matter where you are, we need all hands on deck. And I believe that with your vision and your guidance and your leadership, in our lifetimes, we will see some changes. I don't know, AI has come. I
Yes.
hope it's going to help us. I'm sure it's going to make your life a lot better. But thank you very much, sir. Where can we find you? Are you on social media? How can people connect with you?
I think I'm on LinkedIn. Yes, I am on.
So
Yes, I am on LinkedIn, and I'll be glad to have a conversation with others.
But there's a younger generation and they don't know about LinkedIn. All they know is TikTok and WhatsApp and Instagram. This episode was presented by CDC Labs. They are the people in charge of our technology and our podcast editing. They are experts at full class of business with products. So maybe I'll connect you with them and they can help you with social media. Who knows?
Who knows?
Yes.
I'm
Yes.
already so swamped.
Oh, I don't think you can hide, sir. You can.
Yeah.
Thank you very much again, and I appreciate the time. And everybody else out there, appreciate you listening. And let's go make the world a better place. And see you next time.
Pleasure. Thank you.
Thank you, sir. All
Yeah.
right.
Thank you.
Yes.